Hello, everyone, and welcome back to Always Ageless, where we celebrate living fully, aging wisely, and navigating life's transitions with heart and confidence. I'm your host, Valerie Van de Zilver, and I'm especially excited about today's conversation because our guest has dedicated his entire career to bringing life into the world, protecting health, and now helping families find peace and assurance as they care for their aging loved ones. Dr. A. David Penney, known to many simply as Dave, spent decades practicing medicine across California, Michigan, Wisconsin, in OB-GYN, preventive care, and surgery, and now leads Griswold Home Center Care for Greater Newport Beach with a motto that I love: live assured. Today, we're diving into his incredible journey, the heart behind senior care, and some stories that you won't want to miss. So if you're driving, turn up the volume, roll up your window, and if you're at home, grab a cup of tea and turn up the volume and listen to us. Dave, welcome to Always Ageless. I'm so happy that you're here with us.
Thanks, Valerie. Happy to be here. Thanks for the opportunity to be part of your podcast.
You are so welcome. And, as I was reading about your career, Dave, it struck me how full circle your work is. You've cared for people at the very beginning of life and now at some of the most tender moments later on. That's a beautiful perspective that many people don't get to experience. So let's start here. After all those years in medicine, many people would have just hung up their coats and retired. But you decided to jump into something different, into senior care, and to become an owner and a leader at Griswold Home Care in Newport Beach. So take us to that moment. And what was it that pulled you into this next chapter?
Thanks. Yeah, as you said, I had been practicing as an OB-GYN for close to 25 years and, full scope practice, private practice, academics, and then employed in the last several years. And during that journey, toward probably the last 10 years, my mom, unfortunately, was diagnosed with Alzheimer's dementia. And I, of course, went through those struggles with her as it became more serious. And during that time, I also learned about home care. Um, Up until that point, I actually was quite ignorant about it. It's not something that typically is part of our training as physicians. It's usually something that is uh, kind of I don't want to say pawned off, but it's something that, social workers really help us with. And so we never really learn about what the potential role is and when people might need it. And so it was one of those almost a black box in a way. And so when my mom finally really needed it, I learned about it at that point. And although at that time I was still a full-time practicing physician, um, I it never left me. And eventually she did pass away from the complications of her advanced Alzheimer's. But a few years later, I realized that this one journey that we have in life, it's a one-shot deal. And after so many years of practicing medicine, I realized that there's got to be something more to it. And so you could almost say that I was searching for a new meaning. And as I went through the different things that I could do to make a difference, I realized, although medicine was very fulfilling, I could play a better role in this new world of home care. And, I'd always been looking to go into a different, line of work, kind of a business. But I never knew it would take me to this point. And it added up in the end, because I had looked into various types of businesses
Sure.
until finally I was like, how could I not have looked at this? It just made sense. And my background as a physician really helped me understand the medical side of things. And so that was really just a bonus because it allowed me to understand things to a much greater depth than your average person, to start. And so really thinking about my mom and how she had struggled and how this could really play a huge role in being somebody comfortable at home and safe, it made sense. And so I decided to, dive in.
That is so powerful because you didn't see just a business opportunity, you saw a calling also. right?
Absolutely.
To your family and to the other people that you've seen. And it's
Yeah.
interesting that you mentioned how this is kind of pushed off to the side. I was at an event recently and someone said, well, you don't have to work so hard at this because this isn't really so sexy, right? It's not a sexy thing, home care or growing old. And I thought, how sad, right?
Yeah.
Because there's so much to be gained from older people. And I don't want to start that conversation yet, but I was very sad to hear that. So I'm so excited that you saw this as a not just a business opportunity, because some people do. And I
Right.
imagine that this calling is what gets you up in the morning with purpose, right?
Oh, absolutely. I mean, you can only do something for so long without having something deeper in its meaning and how it, affects your life. And so, not all days are great days. There's always those ups and downs, but I think having that conviction and that dedication really makes every day a good day, essentially, despite the challenges, of helping people and the various things that they face.
You've cared for people at literally every stage of their life, from just the wee bit of birth to the end, the older ages, um, and from making sure now that adults live assured, which is a great slogan. So when you think about it, how has witnessing this full circle of life shaped the way that you view and what really matters the most?
Well, that's a great question. Of course, in my career, I could see, I mean, because I, delivered thousands of babies in my career, and you see the vulnerability of a newborn. And, although, they can breathe on their own and, eat, they can't feed themselves. And, they can't move really. You need to carry them everywhere. And so the vulnerability and the dependence they have on us, that of course was apparent from the beginning. And I never knew that I'd be also helping people toward the end of their lives with those same things. Um, we become vulnerable at a certain stage, oftentimes, whether it be psychologically vulnerable because of dementia, or physically vulnerable because of something like multiple sclerosis or Parkinson's, some condition that basically requires us to depend on someone for help. So I think that was really interesting full circle moment when I realized that that was what I was getting into. And in a way, it made sense, to continue that same journey of helping a vulnerable population, at which, the majority of our clients are in the senior age range, although we've had younger ones as well. So that's been a really interesting perspective and mind realization.
That is, I love that perspective, and it's so needed today, especially for families trying to find their way through tough decisions and to realize that vulnerability. It's so fascinating that you talk about that, because there's two sides to that. I think one is where we realize how vulnerable our older adults are, but also that sometimes we think that they need us to babysit them, and that they're not capable of making their own decisions. And sometimes we have to respect that we should at least listen to their opinions,
Hmm.
right? That they have their own thoughts, and that's always very challenging. And I know you must see that often when you're in homes with
Right.
families
Yeah.
trying to make these decisions.
Yes, absolutely. Because vulnerable doesn't mean incapable or incompetent. It just means there's a certain aspect that requires some assistance, and respecting someone's wishes and their preferences is super important. Um, even someone who may have dementia, because dementia doesn't mean you don't have a preference for something. It just, you know, so excuse me.
Yeah, absolutely. And they need to be treated with respect, because they're definitely vulnerable, right?
Yeah, absolutely.
And one of my biggest fears is that I'm going to be in a position like that where people won't hear me or understand me, and I'll be like locked in my mind or locked in my body.
Yes. And you wonder, I mean, no one truly knows what is going on in the mind of someone who has dementia. I mean, it's impossible to know, and we can only guess. But just because you can't express something in a way that we expect doesn't mean that it's not happening inside, that you're not processing things. And so I think best to assume the best of that person's understanding, and treat them with respect and dignity, and do what you think that they would like you to do.
I love that. And I think that certainly, when I grew up, we had people that went into what we would call nursing homes, right?
Hmm.
And most of them, as they got older, would just be put in a corner. And even people that didn't have dementia at that time, right? They're just put in the corner and they kind of have a bib and they, you know, sit there
Yeah, not a
and
very nurturing environment.
no, 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 not at all. Well, was there a particular patient or an experience during your time as a physician that planted the seed for you caring for seniors, or was it your mom?
Well, I mean, over the course of my practice years, I did have quite a quite a bit of experience with seniors as far as patients go. Because although obstetrics was a large part of my practice, gynecology was just as big, and so I would see people at the older age of, the older part of the age spectrum, and sometimes there were some people that did have a bit of dementia. It was never super advanced, but there was an occasional patient I'd also see that was already living in a nursing home, and they had to be specially transported to the office to have an exam for a problem. So I did have a bit of exposure to it, but I would say that definitely my mom played the biggest role in getting into this. Um, Obviously, she was the closest to me, and the impact that it had on her life was tremendous. And initially, she actually lived with us at home, and some of the early signs of dementia were there, but you know until it's diagnosed, you don't always realize what's happening. You may just think, oh, a little bit of memory loss, it's normal. And so even as a board certified physician living with my mom, I didn't see that the subtle signs until in retrospect. So
Yes,
yeah.
we all think, oh, we've lost our keys, right? Can't find our keys. That's just my mom getting old, right?
Yeah, yeah, yeah. And then eventually, one of the signs, actually, she actually wanted to move out, and she just thought that she was being a burden on us. And it didn't seem to add up, but I respected her wishes, and we found her an apartment nearby. And and then there were some things that started happening when we'd visit. We're It was a senior, an independent living apartment, and so they had people that would come and do cleaning every week. And she would start to say, I think the cleaning people are moving my stuff around. And initially I thought, oh, maybe they are, just to help them, get something out of the way so they can clean. And then she started saying things such as, I think they might be taking things. I can't find this, and I think they took it. And then at one point, the manager of the apartment called me and said, everybody's complaining of an odor from your mom's apartment. And
Uh-oh.
we discovered that there was a boiled chicken that had been sitting in the pot for probably a week, and
Oh,
it
no.
had just gotten rotten. And then another incident happened where she microwaved metal, like a spoon, I believe, and so it really set off sparks and smoke, and it didn't set a fire. But then we realized that this was a little more serious, and there was actually something more going on.
Yeah, that's unfortunate, but it is fortunate that you were able to catch those things when you did and that you lived
Yeah.
close by. What if you didn't?
Yes. Yes. It was. We were lucky. It was 10 minutes away, and so yeah, it would have been very stressful if she had been in another state. Um, Trying to manage, trying to figure out what to do. And so, um, but yeah, then at that point, we were able to, we learned about, we're introduced to the idea of a caregiver. And although I had heard of caregivers, like I said earlier, it was nothing that was part of my tool bag of tools to help patients. And so that was really good. And so eventually she did, get a caregiver who was able to keep an eye on these things and manage them. And um, that way we could feel confident that, hey, nobody's moving or stealing anything, things like that. Yeah.
Absolutely. Well,
So
and
it's
now
very
you and I
reassuring.
know that there are some amazing new age tech
Hmm.
devices and tools and systems that we're going to be able to put in the homes of our aging parents that are going to help us track those things. I was fortunate enough to see some things last week about something on the stove, and it can tell you what's happening and so forth. So that's for another topic, but certainly that will help some of those things from taking place, and our
Yeah.
hopefully our families will be a little bit safer. But Dave, you often use the phrase "live assured," and that's one of your slogans. So, what
Mhm.
does that phrase mean to you personally, not just professionally? What is live assured?
Well, living assured is, yeah, it has many meanings. I think one of the things is having a certain confidence about your life, about living um, safely and in a way that um, allows you to experience the things that give you joy, right? Despite some of the changes that may be happening with aging. And that could be in part helped by people around you, your family, a caregiver, or just the kind of the confidence that you are safe and you're not alone. And I think those are many of the facets that Live Assured encompasses.
So, for the families as well as for the patient themselves,
Yeah, yeah,
client
absolutely.
themselves, not patient so much, but the client themselves.
The client themselves, yeah. Um, because I think that's one of the things as we were talking about vulnerability earlier. Vulnerability um, can lead to a loss of confidence, and I think that can have a real detrimental effect on your mental well-being. You could lead to anxiety or depressed mood. And so having that confidence, I think, is important, and feeling um, reassured as well, that if you need something, there's help, or that you're safe enough to maybe do things um, with either independently or with a little bit of surveillance. For example, if you walk and need assistance with a walker, you feel that you can make it to the other side. So
And I know how comforting and assuring it is to know that your loved one is taken care of by someone. That when I go to work in the morning or I go home at night, that my mom's going to be okay. That someone is
yes.
there with her, that she's going to be all right, she's going to be safe, and um, and so live assured really applies to the families as well. And I know that that's what you want your families to believe.
Hmm. Yeah, absolutely. Families, especially families that live far away from their loved one, because if there's nobody there, you don't. It's harder to feel confident and comfortable. Even if you have a camera around, you just never know where something's going to happen. So it does give comfort to the families to know that they are that their loved one is safe. So absolutely.
From your time in medicine, you've cared for thousands of people. And is there a story, of course, not, you don't have to add names, that still sticks with you today, one that shaped your heart for this work?
Um, as it relates to working with seniors or
Sure,
people
or
in
taking care of people, sure.
caring people. Yeah, I mean, there are lots of stories. I would say the one that comes to mind first actually is of a young patient who was having her first pregnancy, and um, I saw her for her first visit. She had a positive pregnancy test at home, so came into the office for her first pregnancy visit. And one of the things we do initially is to do an ultrasound just to measure the pregnancy and make sure we have the accurate due date. Well, surprise, we found twins, and so that was really exciting. Most people are very excited about twins. And so that was great. It was her first pregnancy, and she has twins. She's like, this is amazing. And we did another ultrasound a couple weeks later because that's what we do. For twins, we repeat ultrasounds a little more frequently, and we found out they're actually monoamniotic twins, and that means that both twins are in one amniotic sac together. Now that's not actually a good thing. That means that they're sharing the same swimming pool essentially. But one of the concerns about that situation is that they could get wrapped around each other, the umbilical cord,
Mhm.
and so that's a very high risk pregnancy, and it has a very high mortality rate actually, unfortunately. So um, when she became what we consider a viable pregnancy at around 23 weeks, we needed to admit her to the hospital. And so that was tough because she never expected that. And
Yeah.
so we admitted her to the hospital, and we ended up keeping there for 64 days. And because at any moment, the twins could have become tangled, and then you'd have a major problem. So we admitted her, and she was there for 64 days, and then we did a C-section. And and the C-section is always done early in monoamniotic twins. I forget her exact gestational age, but somewhere in like 30, 34 weeks, something along that. And then she, it was just an amazing situation. I mean, some might think, oh, is, being in a hospital for 64 days, it's like a hotel room, just watch TV all day.
Oh, sure.
But
Yeah.
it's really grueling on the mind. People go to dark places when they're in the hospital that long, and they can be very, produce anxiety and depression, and it's just mentally very tough. And so I think just seeing how she was able to get through that, knowing that there was a prize at the end, I think that inspired me to, realize, first of all, great having gratitude for not having to be in that situation, but just realizing, that it's inspiring, you could say. And um, so I'll never forget that. And that was pretty early in my private practice career, actually. So I was a fairly fresh, minted doctor after my residency training there. So, and I still remember her name, and I mean, she just was great. And that was, I think, just overcoming medical, difficulties. That was a good lesson in dealing with that for her, for the patient.
Sure. What an exceptional story. And I'm sure she was, no doubt she was very grateful for you and the fact that you cared. And so often, so many of us think that we're just a number to our doctors, especially in these days when medicine isn't quite as personal as it once was. I grew up, the doctor came to our house, right?
Oh, yeah.
I had scarlet fever and he put a sign on the door, nobody could come in. So I mean, and
Um,
now, medicine, it's harder to get an appointment and all those things. So the fact that you cared for her that much, personally, I can see where that would carry over into your care with aging adults. And I wonder, one thing I saw that you did, we'll just go off the subject a little bit here, that you did sing-alongs with your residents and your clients. So
mhm.
tell us about one of your favorite sing-along moments and tell us how that came to be. We can show, Karen, we can show this on our video, but tell us about the sing-alongs with your patients.
Yeah, well, like, so most recently I've been going to skilled nursing facilities, and um, you know, I will bring in my guitar, and in this one particular one that you might have seen, I was going from room to room. As a way of, kind of hopefully uh entertaining somebody that's in a situation where they're, generally not feeling that great, and they're recovering from surgery or something like that. So yeah, I'd go into rooms and basically play songs that I think they'd like. Um, and we'll often have a list that we'll get from the social worker or the care coordinator. They'll interview the people they have for that particular week and might ask them if they have a favorite artist they like. And so I'll come prepared with a variety of songs. And if they don't have a preference, I'll try to guess, maybe based on their age, what they might like. And I'll often go in with our community liaison, Jennifer, and she'll help me out or just be there for, support, and just to liven up the times there. And one one of the songs I really love, some of these songs. Uh, we used to call them oldies. I don't know what we call them nowadays, but like Earth Angel, for
They're still
example.
oldies, yeah.
Yeah,
Earth
they're
Angel.
so
That's an
Earth
old.
Angel, yeah. And I really, excuse me, I really love that song. So I would sing it, but um, it was funny because Jennifer, the first time I sang that song, the patient really, seemed to really like it, but she just, because some people are really at the end, and we're not sure what the recovery is going to be, and so she thought it was sort of maybe not the best song to sing at that time, Earth Angel, just because of
Oh,
the idea, you know.
okay, maybe.
Yeah, yeah, maybe, but I think otherwise, I thought it was really amazing though how music would touch people that would normally not really be processing words, right? Maybe they had had a stroke and they were sort of just not, they were just resting and not really aware of what was going on, or dementia maybe. But playing the music really just liven people up. It's amazing how music can do that. And there were times when I would play and somebody would just start tearing up. And honestly, there were several occasions when I couldn't hold back a tear here or there, because just to see the impact that it would have, especially when I really started, just started doing it. Um, and it's so powerful, the power of music, and how you can really connect with someone. And
The,
so,
the one I saw was when you were singing Love Me Tender,
yes,
Elvis
yeah.
Presley song.
There are a lot of Elvis fans. I do Elvis, Beatles, Beach Boys. And here's the other interesting thing. Some people actually get really into it. We always, say, hey, if you want to get in there, sing there, sing with us. And most people don't take us up on that. But there have been a couple of people where they really got into it. They clearly were into singing, in the past, and so sometimes I would just play guitar and then the patient would be singing the whole song without any prompting. I have a lyric sheet in front of me. They would just did it from memory, and that was really amazing. And um, that's just gratifying. I almost feel selfish. I feel like I get more fulfillment from it, but I think they really did too. But yeah, it's just an amazing experience.
I'm sure they do, and I hear stories so often about people who are impacted by music. I hear actually two things that come to my mind: music and pets. When you take a pet into a, a nursing facility and allow
Yeah.
people to see the dogs or whatever, but definitely music. I hear those stories often where, just as you said, where sometimes they won't do anything, and then maybe you haven't heard from them speak in months or years, and then they hear their favorite song and they just start singing.
Yes, yes, it is amazing. I'm still amazed. Just think, because I haven't thought about it like this for a while, and since you brought it up, it just brings me back, and yeah, it's great.
Is there a favorite song that comes up more often than others that
Love
people
Me
ask
Tender, Love
about?
Me Tender, yeah, Love Me Tender seems to be a real,
Really? Yeah.
yeah. I think it's a very mellow song. It's got a very strong sentimental feel to it, and the music itself, I think, really enhances that. It's not just the lyrics, but the music. It's like one plus one is more than two in that case. Um, and so that's probably one of the fan favorites. And then Beach Boys, a couple of Beach Boys songs I do that get get you going. It's yeah.
How exciting. It's so great that you do that and then do that. If they know you're coming, then they ask for requests in advance and give it to you when you get there. Is that what happens?
Yeah, so the activities director, it depends on the place, but like the activities director or whoever's collecting information will go around on the day of and find out, who's there, who's going to be open to the music, because they want to make sure they don't mind, because we're going into their room, and so
Um,
the staff wants to make sure that the patient's okay with the visitor that day, because some people may just want to be left alone, which I understand, and others. Most people are open to it though. So yeah, there's a list, and then they'll ask them if they have a preference, certain song or genre. Yeah.
I would guess that when some people hear music in the other room, let's say, they must be jealous. There must be some people who are envious that the music is in the room next door and not in theirs. Does that ever happen when
Yeah.
they want to
I
come in?
sometimes, yeah, sometimes we'll be near the door and then we'll get people that are walking the hallway up to us. And so there might be other people that are like, well, I'm glad he's not in my room.
Probably not many, though.
Not
Probably.
many. Yeah. I mean, I don't claim to be a great singer or anything, but I can get by. So
But as they say, it's the thought that counts, and it's important the impact that you have on people that day. And as we
yes.
talked about, people who are kind of just in their own world, and you're able to bring them out of that world. And as we said, as you said, we don't know what's going on in their mind.
Right.
And
Yeah.
and I think there must be so many people who would love to have music around them because so many of us were raised with music, either at church, if you went to church like I did, we had music around us all the time. And then we had, the Beach Boys and Beatles and all those things. And that would be always my wish, is that there'd always be music around me. I think we don't
Yeah,
realize.
I totally agree. I think it's such a powerful medium to connect with people, and um, I guess that's why every culture in the world basically has some form of music. When something is that powerful, it makes sense that everybody in the world would have their own version of it.
Yeah. Yeah. I was at a community that's close to where you and I both are located over in Tustin,
Hmm.
that um, one day somebody was there playing, and they were playing what you and I would call American song music, not really Broadway, but the
Hmm.
early American song music. And thinking about those people just got to sit around for the afternoon and just sing, and someone comes and plays the piano for them, and whoever wanted to be there could be, but the room was packed with people that were seeing the American songbook type of music. So that's
Yeah,
pretty
yeah.
impactful. I know that let's talk about your work at Griswold and your business side. I imagine you've seen a lot of families who were just paralyzed with worry at first. The thought of having a caregiver in their home, or not knowing really what to do next with their loved one, whether that was even the right step or the right decision to make. So, can you share a story? Of course, you don't have to name names, of a family that you've helped where you saw a really incredible transformation.
Yeah. Um, so let's see, we've had a few families like that. I would say one, well, yeah, we can't name any names. But there's a couple, and we're mainly helping the husband. It's a husband and wife, and he has cancer. Um, but it's chronic at this point. He's in remission. Um, and one of the we actually received a referral from another one of our offices down in San Diego, and so we interviewed the family, and they have a lot of support, and it's a great situation, but it was getting tough on the family members, the children, and so that's when they sought our help. And one of the things that we started doing was, of course, we did an assessment and found a caregiver who was a great match. But one of the things they started doing was going to their favorite restaurants. And so that became part of their normal routine when the caregiver's there. They typically will be a lunch, and there's a couple of local places where they just used to always enjoy going, but it became too difficult for their family members to take them, and of course the client couldn't drive anymore, and so that became one of the routines. And so a couple of local establishments are their go-to places, and sometimes they'll go there and then they'll just drive over to the beach and just park and just sit there and looking out. And that's made a huge difference. Because prior to that, the client with cancer, just he was basically in his recliner at home in a bedroom, and could maybe go to the backyard or the front yard a little bit, but not having the ability to go a distance just really lowered his mood. And so, because he used to be a very active outdoor person, and so to even not be able to go to his favorite fast food place, a burger place basically, and then there's a diner, a diner chain in our area. That was just a real kind of a punch in the gut, not real, not being able to just do that simple thing. And so we've been able to kind of make that happen again, and they've been real happy. And it's just the little things like that that make a huge difference.
And I'm sure it does. I know I see this happen so often with people. We hear these stories. It takes them from, the socialism that they need, right? They need to be around other people and be outside. And what a difference that makes.
Hmm.
And for some people, they get to go to church, and for some people, their caregiver is able to take them out. And my mom loves to go to Polly Pies with her caregiver.
Oh yeah.
Then she always in Huntington Beach, and then she always brags about there's always somebody old that comes and sits next to her. Well, my mom's 105, so she's
Oh,
pretty old herself. But
wow.
I love that story though, because it is a reminder that asking for help and being willing to go out is not a sign of weakness. It's actually a sign of wisdom. And it's so great that you have staff members who will go out with them. So let's talk about, for people who may not have been with us at the beginning of our conversation, maybe they're wondering in their case, is it time for help? So what are a few practical signs that you bring in that would help people know if it's time for home care support?
Well, that's a good question. One of the things, because there's different facets of this. One of the things that happens is a family member is the primary caregiver, and they notice that they're really um, unable to provide any self-care for themselves. They're giving up their own well-being to carry out this caregiving role. And although they love their family member, their spouse, whoever the person may be that needs the help, they're sacrificing their well-being because they're not able to do the things they need to do. They can't even do the mundane tasks like getting a haircut or taking the car for an oil change. And then there's also the constant stress of worrying about their loved ones. So what we call respite care is one of the big things that we help with, where someone needs just a break. It doesn't have to be a long break, but maybe a few hours, a couple of days a week, or a whole day, depending on their situation. Um, and sometimes that time they can't devote time to, say, their children, because if their child lives out of state, they can never visit because um, they are taking care of their spouse as the primary caregiver. So then that's one of the signs that we see where people then really need help, and sometimes they don't need it, and it takes someone else to tell them, hey, there is help for this situation. Then they refer them to us. Um, and then once in a while they realize it themselves, they need help. But that would be a real common reason that people seek us out. Um, the other thing would be if someone's not a primary caregiver, but just recognizes things that are happening. Um, Say that their spouse is getting up in the middle of the night and doing something that could be hazardous. Maybe they're unsteady on their feet and they want to cook or go outside in the middle of the night. And something like that kind of triggers them to realize, okay, maybe we need some help here. So that'd be another example. But I mean, there's quite a variety of things. Often children will start to recognize things in their parent. They may go for a holiday and realize, hey, dad's seems to be more quiet these days. Or he's had problems with his blood pressure. Is he taking his medications? Maybe he's forgetting and nobody's realizing it. And so things like that can be important, especially if the children live out of state or out of the city, and they're not able to attend to their parents' needs every day.
Right.
Um, they may recognize these things and then seek us out to help.
These are certainly important signs, and sometimes it's not one big crisis, it's a lot of little things. And we talk about in our
Mm-hmm.
group that it's sometimes there's 7 things that happen, right? And then there's something that, like, you get the call, right? The
Mm-hmm.
call is when they fell for the 5th time, or they can't get up, or they did something, that was dangerous, or you go over there, in my case, and the stove is on and has been all
Yeah.
day, and the house smells like gas, right? And those are the things. Let's talk about, we're getting closer to the end, but you talked about, and I know in my own experience, and we both know with experience that we've had with our parents, how important it is to choose the right agency to help with your
Mm-hmm.
home care. And today, everybody's bombarded with options. There's ads, there's websites, there's promises. How can families tell the difference between one home care agency like Griswold and another? Because they all seem nice. Everybody seems
Mm-hmm.
nice. So how can
Yeah,
we really, I mean, I listen to you and I think I would love to have someone who also is a physician who also happens to care enough that he goes and sings and does really cool things. That's someone I'd like to associate with, but I may not have that same option. So how do
right.
you choose how you should pick the right agency?
I think the first thing for anyone is to make sure that the agency is licensed. Um, you'd be surprised how
Aren't
many
they
agent.
all? They don't have to be.
Well, they're unfortunately they're not all licensed. In California, all home care agencies are required to be licensed and operated under the regulations of the Department of Social Services in California. Um, and surprisingly, not all agencies or individuals are licensed to provide home care services. So that would be the first thing is, and it may be as simple as asking for their license number, or researching it on, looking it up on their website. Because by being licensed, a home care agency has to abide by certain minimum requirements of operation. For example, only hiring registered caregivers. In the state of California, caregivers have to be registered. And what that means is that they've undergone a background check and don't have any, criminal history that would be on the,
We
you
hope
know,
not.
we're not hot. Surprisingly, there are agencies out there that are operating without a license. And so no one knows if they're really hiring caregivers who are okay or not. And it's actually a big problem in California because there are actually thousands of entities, and that means either an agency or an individual providing home care services, who are operating, sort of under the table. And so that's one of the challenges that we have in our industry is identifying, you know, those people, so that they can either get licensed or, stop operating. And, excuse me. It would be kind of like if your pilot wasn't officially licensed and they just sort of said, somebody taught me how to fly a plane, I can do it, trust me. Or if you're, let's just say you're a surgeon, you have a surgeon that's operating on you, and yet they have, um, you know, they've been under the influence on multiple occasions, and you don't know about it, and that is something that really should be out in the open. And there are certain criminal violations that are considered, like a hard stop for being a caregiver. And so ultimately, the people that are considering a home care agency really should just make sure that their agency's licensed, and that's pretty easy to do. You can ask the agency them, what's your license number, and then you can look it up. And then once they start to consider a caregiver, once they match a caregiver with you, if you do decide to go with them, ask for their home care aid number. And that's a number that they should be willing to give you so that you can look them up. Um, and if they're working for an agency, then that should be current. And those are the two ways that you can really make sure. Now, aside from those, um, home care agencies they have their own personalities in a way. And so it's kind of like a Big Mac and a Whopper. Some people just swear by Big Macs. They're both good, they're both legitimate. But just some seem to resonate more than others. But I think that if you're going to look for something, really, you have to have a feel for the agency, that they're there to really, number one, promote safety. They're not just an assembly line that's trying to get, a high volume. You really want a group of people that is really truly concerned, because there will be difficult times, and you're going to want to know that they'll bend over backwards for you. There are certain times when we have to, help people, even if it's not in our own best interest. When I say that, I mean, that we might lose money, but because we've committed to helping them, that's what we have to do to provide that safety. Because there are clients out there that are depending on us for safety reasons, and if a caregiver, for example, calls in sick and there's not a replacement, we can still provide that fill-in, um, because of how our operation is basically dependent on having a caregiver fill-in available. So that's not normally out there doing care. It's someone who's specifically for that reason, um, you know, available.
And
And
isn't
so
that one reason why people need to consider an agency versus just an independent, someone who's a friend of a friend who needs a job or who, oh yeah, they do that on the
on the
side?
side, yeah, exactly. Because if you have an individual that you're hiring directly, they may have a legitimate illness and can't do the shift, or they might get in a car accident and then they're out of commission. So at least with an agency, you do have the backup ability. And not to mention, you also have the annual training that's done every year, and keeping track of licenses, and even keeping track of a driver's license. We make sure that all of our caregivers are able to drive clients, and if their license expires, well, that's not a good thing. Or if it was revoked for some reason, there might be a real reason that they shouldn't be driving. And
No,
so,
that is not a good thing.
no.
I have a question for our listeners and our viewers who are listening to this and saying, yeah, but I don't really know what I need. Um, so, what if somebody says, I only need someone 2 days a week, or I only need someone half days, or I only need someone overnight? And they just really, number one, maybe they don't know what they need, they're not sure. What kind of flexibility does your group have? Does Griswold have in providing services to families?
Yeah, I mean, we start off by doing an assessment of everybody's need, and once we've done that, we recommend what we think would be, um, a safe number of hours. Of course, the family has their idea of what they need as well, and so once we've come to an idea, we accommodate that. So it could be somebody needs a half day once a week, and we make sure that we find the caregiver who can do that. Um, we have a roster, and we have a way of searching that list that's very specific for each client, and so we just really are flexible. It could be somebody needs care every day, or somebody needs care once a week, and we even have some clients that have surgery, and they just need us to be there to take them to surgery, and then take them back home, and then maybe stay with them overnight, and then that's it. And so there's a wide variety of needs out there, and we basically accommodate what they need.
And I know that it's not ideal, but are there ever situations, if kind of like a respite situation, where if someone's going to be, let's say I want to go on vacation, but I've been my mom's caretaker for 7 years and I need someone with her.
Hmm.
Are those services available?
Oh yeah, absolutely. Um, In fact, the couple I was telling you about that we take to the local burger place, and that started off as a 1 week caregiving you know job.
Arrangement. Yeah.
Yeah, yeah, for the so that their son, their family member, could go out of town, and that was before we became a regular provider for them. And then several months later, we did it again. There was another week that they needed help, and then a few months after that, they wanted help every day, and so we started providing that. So yeah, that's very common.
And that's the ideal situation, isn't it? That everyone's so happy with your services that they don't want you to leave.
We strive to achieve that.
We do. We do. Unfortunately, we're close to the end of our time with you, and I'd actually love to have you back again and talk about some of the things, some of the questions that we weren't even able to answer today. I especially admire um your background and how it fits into the the care for seniors, to have someone who has seen life from the very beginning to the end, and that you still have the patience and the desire to still stay with people and take care of them, because I think a lot of people who've worked as long as you have they just get tired of it and they're just ready to give it up. But instead, your passion and your desire for caring for seniors is so obvious, and it's so impressive.
Well, I appreciate that, Valerie. It was a pleasure to speak with you, and I really enjoyed this.
Well, let's talk about just a few minutes. We have just a few minutes left. Um, I know what your team at Griswold Home Care is doing every day, and not just providing tasks and services, but giving families something so rare and so precious, peace of mind and dignity, and a sense that they can, as you say, live assured. And I'd love to ask you this, Dave, if you could sit across from a family right now, one who's scared, overwhelmed, they're feeling guilty that they're going to have to leave their loved one in someone else's hands. And you could share just one piece of advice, one piece of wisdom from all your years of caregiving, both as a doctor and now as a senior care leader and having taken care of your mom. What would you want them to hear deep in their hearts?
Um, I think the first thing would be, number one, that they're not alone, that there are people that are there, such as us, that can help them through this journey. Um, it's natural to feel some guilt and a feeling of helplessness at times. Um, that we can help them in that journey, and that our main goal is to provide safety and reassurance for their loved one and for them, and that this is a very it's not a one size fits all solution, and we do everything um, to focus on the individual, and that includes the family members as well, and that in the end, things are going to be okay. There's a solution for every problem. It's just a matter of getting to that point, and that's through conversation and listening, and that's what we really strive for, that communication.
And certainly, I think that sometimes your patients are the families as much or more so than it is the aging adult themselves.
Yes, that's 100% true.
Yep.
It's that's we often see that like in pediatrics and in veterinary medicine, the patient is sort of the patient, but
Not
then
the
the
patient,
person,
right?
yeah, yeah.
The patient, not the patient. For those of you listening, you may be wondering what steps to take next, or just how to understand how home care can support you and your loved ones, if at all. I encourage you to reach out to Dave and his wonderful team at Griswold Home Care for Greater Newport Beach. And should you not be in the Newport Beach area, that is not a problem at all. Their motto, Live Assured, stretches out in wherever they're located in the entire United States. So if you have an aging parent or adult in another state, even, Dave can help you find the same kind of care that he gives to your loved ones in another area. Thank you so much for sharing your wisdom, your heart, your journey with us today. You remind us all that caregiving isn't just a job, it's a service, it's an act of profound love. And to those of you just tuning in, remember to join us again next week for another episode of Always Ageless. Remember that life's moments aren't measured in milestones alone, but in the care that we give, the trust we build, and the love we share. Until next time, I'm Valerie Van de Zilver with Always Ageless, where we celebrate living life fully at every age and every stage. Stay curious, stay connected, and always stay ageless. Thank you, Dave Penney.
Thanks a lot, Valerie. It was my pleasure.